So, good morning to everybody that's joining APP 703. We don't have a vast live audience, so I'm making the assumption that the rest of you will be accessing this material on the DLE. So welcome to APP 703. So hopefully that's the module that you're expecting to be attending this morning or listening to later. And what I plan to do is spend some time going through the DLE site initially, and then we're going to have a refresher session on research methodology. That's our plan for this morning. So hopefully all of you can now see the DLE site titled APP 703 Advancing Research Knowledge in Practice number 2. If you are looking at it now, you'll see that there are a number of silly penguin pictures. Those of you who know me and have been on a module with me before will know that I like my silly pictures on my module sites. And although it might seem like a slightly trivial approach, what I do find very useful is the ability to tell people where to find information, and also ensures that you're on the right module site. So if you go onto your own personal DLE and go down to the drop-down menu, and there's a number of courses like there are on the side navigation here. These are all the courses and programs that I'm involved with. You should have a similar list, obviously not quite so long, with the modules and programs that you are involved in. And if when you tap on APP 703, you don't come across these silly pictures of penguins, then you are enrolled on the incorrect page. So please ensure that when you are looking at your own personal DLE page, that these are the silly pictures that you can see. So we're going to spend some time just having a little look about the information that is on this page. We've obviously got announcements at the top, and if I have to make any urgent changes or there's anything that you need to know, the announcements will appear there. The next tab down is your assignment tab, which is where you submit your project proposal on the submission date. So if we open that, you will see that it is due on Wednesday the 25th of October in 41 days and 5 hours time, and there'll be a countdown. And when you open that page, it'll look slightly different because it won't say participants and submitted and needs grading. It'll just give you the option to submit. When we have our one-to-one tutorials, we'll talk about how to submit if you haven't submitted electronically at Plymouth University yet, which I think is only Joe that hasn't. So that is the first page. The second tab down is the module evaluation. So at the end of the module, when you've submitted in October, I will ask you, and I will also remind you, to complete the module evaluation, just so that we can look at development and how the module's gone. The first tab, the welcome tab, with the flying penguin and the suitcases, has a large amount of information available to you. There is the module record to start, which you can look at your leisure. The module information booklet, which outlines a little bit in more detail what the module involves and what the requirements are. And again, you can read that at your leisure. There is also the timetable, which has gone over to the other screen, so excuse me for a minute while I bring it over. The timetable, which outlines exactly the plan for the module. We have this morning, introduction to the module. We're going to talk about the assignment in a little bit of detail, and we're going to talk about the research methodology recap. And then this afternoon, I'm going to do a session on writing your project proposal, research proposal. Tomorrow, it says 11 till 1, but I think when I sent out the webinar links, it said 10 till 1. Rona is going to be doing a session on advanced literature reviews. What time would you like to start?
10's fine for me.
Okay, so if everybody's okay with 10, we'll start at 10 o'clock. Then on Monday we have our workshop day. It'll be wonderful if as many of you can attend as possible, and there are rooms there. If you can't attend, please can you let me know in advance of Monday, and we will work out a Skype connection. It will be easier to Skype you into those rooms rather than webinar you in. So, and if you can't Skype, if there's any way you can access Skype, it's a very useful mechanism for you to join. It makes it much more interactive. Then on Tuesday we have got ethics, and my booking for ethics has come through from 10 till 1. It won't take quite that long, but we'll start at 10 o'clock on Tuesday, again via webinar. And then on Wednesday it says tutorials. I'm very happy to have a tutorial at a time of your, well, not quite at the time of your wishing, but if you don't wish to have a tutorial on Wednesday, you wish to do some work and maybe come back to either myself or Rona in a week's time, then I'm perfectly happy to organise a tutorial then. But we can discuss that on a one-to-one basis. So if you'd like to email me with what you would like, probably after Monday, then we can sort out tutorial time. Tutorial time can be, again, at your convenience, either face-to-face, via Skype, or over the phone. The most beneficial mechanism of tutorial is to actually have something to go over. So if you've written something, at least the minimum would be a plan to make the tutorial worthwhile. I'm just looking at Rona for her agreement there. Because otherwise we're just recapping. So if you've written something, you've got something prepared, you've maybe even wait until you've got a first draft and then have a tutorial. It's completely up to you. So we'll be quite flexible, but I am available all day Wednesday for some tutorial time if you require it. So that is the timetable. Then there is a couple of links there about webinar tutorials and webinar support. If there's any issues with the webinars or any support required, then those are the links to use. The next tab down is the assignment guidelines. The assignment, as it says, is submitted on the 25th of October, and what I've got here is a breakdown of exactly what we require and how the marks are allocated. So if we start at the top, the assignment, the project proposal starts with an introduction where you outline your chosen subject and you give us a little bit of a rationale for why you've chosen that particular area to investigate. The next section is a literature review, and Rona will be talking in detail tomorrow about what the expectations of the literature review section are, but it's about providing a clear context and rationale for the project that you intend to undertake. Then, as you can see, the bulk of the marks are allocated to the proposal section, where you outline your research or project aims and objectives, clearly stating what you are intending to do with this project, outline your methodology, so this is about your philosophical underpinnings, then how you're going to collect data, then how you are going to plan your investigation with an achievable timeline, how you are going to analyse the information that you have collected, and analyse the information that you've collected using a robust tool to support your research aim or project aim. Then we have a section on ethical considerations and ethical issues. This is where you will outline how you have thought about the ethical issues surrounding your study. And then the final section is a conclusion and a recommendations. And this is about you highlighting what you expect to find from this study. Obviously not predicting the results, but what the expectations are, and then making some recommendations possibly for practice. So briefly, that's the project or research proposal assignment. The following piece of information I've added is some information about the substantive professional project, which I've clicked accidentally, but I have also got open. Excuse me a moment, my computer's having a having a little bit of apoplexy. Let's have a look. Why is it not? I've given you a little bit of information about the substantive professional project. All of you on this module, on this particular run, are moving forward to this option for your final part of your Masters. Obviously, this module also sets you up to do the 60 credit dissertation module, but from my understanding, none of you are taking that route for this particular group, that you're all taking this 40 credit substantive professional project route, which is why I've added this piece of information to the site. This gives you a little bit of information about where you're taking this project and where you're taking, so that you can think carefully about how you are going to put together your project proposal. So if we look at this piece of information, sort of a short descriptor of the module, what the module aims are for the 40 credit module and what your assessed learning outcomes. And the assessed learning outcomes are not enormously different from the research project. It's just a slightly different focus and a slightly different word count. So you're still thinking about critically evaluating the literature, coming up with a project question or research question, and then how you are going to collect evidence or develop evidence that's going to inform practice. So those are the critical issues that you're thinking about when you're developing your project proposal. So that's there for your information. Also, there's a link here to the Primo searching. Now, all of you, again, I think without exception, have done some sort of library induction through Plymouth University and therefore are aware of our library functions. But if you haven't, there is a link there to the Primo search, which is our key search facility for literature within the university. So that is the first tile. So there's lots and lots of information on that under that first penguin. The second penguin is the one with the blue scarf, and that has the information about writing a literature review, which is the session you will be having tomorrow with Rona. And there's also an additional piece of information there about writing at level 7. And it's very important for those of you who have just finished postgraduate diplomas, you're writing at level 7 still. For those of you who are coming back to study after a short or maybe quite a long break, just to remind yourself about what is expected at level 7, what is expected at master's level, how you're meant to be writing, what you're meant to be thinking about. So it's just some information there. And as I said, Rona will be doing that session tomorrow. The Sleeping Penguin has got this session for this morning, which we're going to start about research. So it's refreshing a lot of the work that we did in the first research module, if you did it here, or research modules that you've done in the past as part of your previous study. And then we've got writing a proposal which is the session we're going to do this afternoon from 1 o'clock. As sessions are undertaken and recorded via webinar, as soon as the recordings are formatted, they are uploaded to the DLE as YouTube clips, so you can listen to the narration as well as look at the presentations at your leisure. Ethical Considerations has the session for Tuesday that I'll be doing, and it's about thinking about the ethical considerations of collecting, retrieving, storing and managing the data that you're going to be collecting as part of this project. So we're just going to have an overview of ethics and some of the ethical considerations that you might have. The expectation for this project is that you won't have to go through a formal IRAS process, but it is important to think about the ethical considerations and so that we can ensure that the project that you're developing for the module in November doesn't have to go through those processes, but it will have to go through some sort of research and development process, either in your trust or within the university. So don't make the assumption that there will be no ethics requirements. I think we have to assume that there may be some, and so I do want you to be adequately prepared for the fact that you might have to think in advance of November what ethical considerations you need to think about. So we'll talk about that in a bit more detail on Monday during the workshop, but also on Tuesday during the ethics session. So don't assume that you don't need ethics. I think the best default position is to assume that you do.
Yes, because it also makes you think about the nitty-gritty of your project, and I don't think there's any harm in doing it at all.
So as I said, there is an assumption that you won't need to go through a full integrated research exercise through IRAS, but you will need some ethical considerations. Then we've got writing the research proposal, which is the very happy penguin at the end. And I'm going to add there's one previous example in there at the moment, and for reasons beyond my knowledge and comprehension, the other examples I have managed to become infected with viruses. So I don't have, I couldn't upload them to the DLE yesterday, but a very clever chap in IT is trying to work out why I couldn't do that. And so I will upload more examples probably before Monday, but I'm unfortunately can't upload any more examples today, or couldn't yesterday. So at that point, are there any questions about the DLE site? Pause for thought. Any questions? If you can't think of any questions now, you might, if you have any questions, then do email me. Okay. You got anything you wanted to add, Raina?
No, not at this point.
Okay, so all the information is there. There's a lot for you to look at, but please spend some time going through some of the things that we've just touched on this morning. So the module handbook, going back to this tile, the assessment guidelines. Obviously, we'll cover that in quite a bit more detail this afternoon. The substantive professional project, as that's the module that all of you are going on to. And revising some of the material around Primo searching and so on. So there's all of our happy penguins. Okay. If there are no questions, we'll start looking at the first presentation. Love technology. There we go. So hopefully all of you can see now the research, advancing research knowledge in practice 2 slide. So maybe unfairly or fairly, I'm not sure, I'm making the assumption that as you have come to the end of your master's journey, or this is the final stage of your master's journey, that research and research methodologies and paradigms of research is very much revision now rather than new information. So if that's an unfair assumption, then please let me know, because I'm going to go possibly quite quickly through some of this material that I would expect you to have a reasonable handle on by now. Just looking at my colleague for affirmation. Hopefully over the course of the last 2 years, whether that 2 years has been in the last 2 academic years or a lot previously, you've been using, synthesizing, managing, analysing material that you've collected and you're reading regularly. And one of the really interesting pieces of information on the Writing at Level 7 PowerPoint is about the more you read, the more you know, more knowledge you gain. The more knowledge you gain, the ability to analyse becomes easier, and therefore it becomes slightly easier to write. And so you should all be getting to the stage now where your knowledge about research and research in your particular clinical areas is something that you are very, very familiar with. So this should not be news to you, that in research terms, we look at paradigms, we look at perspectives, viewpoints. So we look at qualitative and quantitative data. So we have the quantitative view, the positivist view, which I'm sure all of you are very familiar with. In health research, there's an awful lot of quantitative research out there. Some of you are working in very specific clinical environments, in critical care and surgical care, and advanced practice, where there's going to be a massive amount of quantitative positivist data that you can use to inform your practice. Equally, and a growing body of knowledge in health service research is the qualitative research and the qualitative viewpoint now. It is building. It has less physical funding, certainly in this country, but there is a growing amount of interpretive or humanistic data that's being developed. So the research that you're looking at will be coming from these two opposing viewpoints. So when we talk about types of research, we talk about deductive quantitative research and we talk about inductive qualitative research. And the deductive quantitative research is the kind of research that is testing a hypothesis. And I'm sure we could all identify in our clinical practice a study where we've read that has a quantitative approach, where we've tested a hypothesis, we've done some evaluative research, we've got a randomized control trial, we've got a drug trial, we've got a piece of research that has evaluated an intervention against another intervention. So we've looked at it from a positivist framework. Equally, in all of our practice, we should have come across research that's inductive and qualitative, that's advanced theory, something that is explored, examined, investigated, something that isn't necessarily measurable or testable, but is simply been there to advance theory. So I'm going to look to Rona to see if she's got anything to add while I get something to drink.
I think I would just add that I think in healthcare that qualitative research has been underestimated and often undermined, that it has an equal place in research. So it should sit well along randomised control trials, because it's all well and good having numbers, but we need to know what's actually happening behind the scenes in the decision-making processes. So don't underestimate the value of it.
No, yeah, but unfortunately, I think historically funding has gone to something that can be tested, something that can be proved, and I know that from my personal experience, and I'm sure Rona does too. That, you know, what are you going to prove doing this piece of research? What are you going to prove doing this project? And these are questions that you've got to think to yourself when you're developing your research question for your proposal, and certainly for your project. Is, am I actually seeking to prove anything? Don't be bound by that idea. Be inventive. Advancing theory is just as important as testing a theory that's already in existence, and we can't advance the way we think without qualitative research. So some of the qualitative research and qualitative projects will be really groundbreaking and can be really very innovative. But I know from experience and from talking to some of you that are undertaking this module, that you're concerned that your areas of practice are going to want a result from the end of it, want a definitive yes, no answer to something. So if you're going to do a project that's going to evaluate a specific piece of practice, what are you going to prove at the end of it? And that might be a management way of thinking, but don't be bound by that. Try and think what you need out of this project as a educational exercise and an academic exercise, because it is actually your masters, it's not your trusts. So they might be very keen for you to prove something, but don't necessarily feel that you have to. And certainly from the support that you'll get from myself and Rona and everybody else on the team is going to be, I don't need you to prove anything. Advancing theory is perfectly acceptable.
Absolutely, and I would just add to that, actually, those who've gone on to what was the MCH 504, which is the dissertation module this year, I think many of them started out with that quantitative outlook, but I think all but one are now doing qualitative research, so they've actually transferred their sort of allegiance, if you like, and looking at things in a different way. So be open to it, is what I would say.
Mm-hmm. And also it does, and we'll talk about this in a minute, about ontology and epistemology. You need to think very carefully about where you're coming from as a practitioner and what you want to do, and how you deal with knowledge generally. So we've got these two different types of research, and this is just reiterating what I've just said about qualitative research, is looking at words and reason and understanding, and there might be an element of subjectivity surrounding it. Whereas quantitative research tends, and doesn't always, but tends to look at numbers and a cause, something that we need to explain, so there needs to be an element of objectivity. So you look at your position as an investigator in terms of the information that you're collecting. Are you going to be subjective and involved, or are you going to be objective and detached? So in research and any kind of investigation development, we need to think about our theoretical foundations. And this is really, I think, what sets an undergraduate project apart from a master's project, is the level of discussion on theoretical foundations. We need to think about our ontology, epistemology, methodology and method, and I think it's absolutely vital that we have some headspace to think about where we're coming from in terms of ontology and epistemology. And these are words that hopefully at this stage of your masters aren't new to you, but they are things that for this stage of your masters, i.e. the final stage, that you really need to get a solid grasp of. So when we talk about ontology, we are looking at, again, our interpretive or positivist viewpoint. An interpretive ontology is the idea that reality is mentally constructed, socially and culturally based, and that multiple realities exist. The idea, if we're coming from an interpretive ontology, is that we do not have a yes-no answer, that the world is not a black and white place. And I think if we look at practice generally, there are a lot of concepts which are not black and white. If we think about pain management, for example, it's not you are in pain, you are not in pain. Yes, we do use visual scales to measure what the perception of pain is, but if we ask somebody how much pain they're in on a scale from 1 to 5, 1 being the no pain at all and 5 being the most pain we've ever been in, a 4 for you and a 4 for me and a 4 for Rona and a 4 for everybody in the environment would be completely different, because it is socially, culturally, environmentally, mentally different. And a 4 today won't be the same as a 4 tomorrow, even for the same person. So the idea that we've got these fixed entities that exist, that there is only one answer, is, to me, as an interpretive researcher, completely ridiculous. But I have colleagues and I have close friends who are absolutely driven by natural law, that reality is objective. It is completely independent of perception. So that positivist, this is a black and white world. And I'm sure if we sat and thought about it for a while, we could all identify somebody that is very black and white. It's a yes-no answer.
Absolutely.
And they completely rely on that idea that you either are or you're not. And there's nothing in between. Now, to me, because I'm completely in the interpretive camp, can't get my head around that really, because I just don't think life's like that. But I'm sure all of us could identify people that are. And so when you're thinking about the problem, issue, practice, project that you intend to undertake, is it something that you can measure? Or another question might be, is it something you want to measure? Because it might be possible to measure it and test it and evaluate it in a completely black and white way, but is that something you want to do as an investigator? So what are you trying to find out? And that's a question that you'll constantly keep asking yourself as you're developing your project proposal. What am I trying to find out? What am I trying to do here? Am I trying to make a yes-no answer, or am I trying to simply explore the possibilities? And this is when it comes down to you thinking about your ontology. Anything you want to add to that?
No, I don't think so. I think you've covered it very well, actually. And I struggle with the idea of black and white completely. And I sometimes think that would be really nice, actually, because it's an easier way to think about things, but life's not like that. And I think cultural differences are huge, particularly when you look at pain. So pain is taken as almost like an objective thing with these pain charts that we have, but there is no way at all that we can actually really look at it like that. It's easier if we do, but it's not necessarily correct there.
Mm. And as Rona just said, it might make life easier, because if we could just count everything and measure everything and quantify everything and put everything quite neatly into a box, and in certain areas of science that's absolutely appropriate, so your physics or your chemistry or your purist science, then those boxes are absolutely acceptable. But the problem we always face in healthcare is that people just don't go in boxes.
I was going to say, we're dealing with human beings, and that makes it completely different. We can't actually do those boxes at all.
And I can remember back in the sort of late 80s, early 90s in healthcare, there was a huge development of these integrated care pathways that patients were meant to, everybody that was coming into hospital for a laparoscopic cholecystectomy, for example, because my background is surgical and intensive care, is, everybody would go onto the lap chole pathway. But none of them did work, because people just don't behave. They've not read the book, have they? They've not. They don't know what a lap coli is meant to do, so they all behave differently. So that sort of programmed response to healthcare doesn't always work.
I would agree with that, because my background is ED, and we had the same things for sort of asthma and shortness of breath, those pathways that came in. And I remember having people lined up actually with cylinders with of oxygen, but they all responded differently. So how can you possibly have that idea of one pathway fits all?
And so when you're thinking about the context, and I know Rona will talk about this a bit more tomorrow with the literature review, when you're talking about the context of your practice issue or project proposal, it might be because the guideline or the protocol that's been written or is about to be evaluated is problematic, and that's why there is this practice question or project question that needs to be reviewed. And hopefully all of you have got a pretty sound idea of what you're going to investigate in terms of your project proposal. But you might be slightly uncertain at the moment about the approach and the methodology and the kind of way you're going to get around your practice development question. So, and these are the things that you've got to think about before you actually start writing the proposal, is to actually think about, right, where am I coming from? What do I want to do? What is my ontology? So an essential part of the preparation is to actually get to grips with what is your ontological base. And then we need to think also about our epistemology. And so in the interpretive epistemology, knowledge is constructed, as I said, in a social and historical context. What we know now in 2017 is not the same as what we knew in 2007 or 1997 or 1987. So it has changed because of historical and social context. That findings represent the creation. In an interpretive paradigm, your epistemology is about the creation of that information. So the interaction between you as an investigator and the subjects that you're investigating is part of the process of development of knowledge. And I've said there, truth is based on pragmatic criteria. And I have to say that's a phrase that really resounds well with me personally, because think very carefully at this stage what pragmatically you can actually do. And this will be enormously linked to ethics, and it's enormously linked to your own personal skills and your own personal environment, because what you might like to do is not always possible. So don't give yourself a completely impossible task. Be realistic, and also remember that this is a master's piece of work. This isn't a Department of Health funded PhD with a team of researchers. This is a practice development project that's for your masters. So be pragmatic and think to yourself as an investigator, as an inquirer, where are you going to be and what are you going to be able to do? Obviously, if you're taking a positivist stance, you can be far more detached and far more objective, and it might be about auditing and collecting very specific, discrete pieces of information that might be slightly less involved. But the positivist believes that what they're collecting are the facts, and that's again what you might want to collect facts, and that is absolutely fine. But just remember that what you're collecting has to reflect what you're asking. And this is about linking your project aim with what you want to do. So if you wanted to find out how people experience pain in clinic, and then we're collecting a number of scores and how many prescriptions had been collected, that's not answering the question that you've asked. So you might think, okay, what I want to do, what my manager wants me to do, this is another thing that we get thrown at us quite a lot. My manager wants me to find out why people come back to clinic or something. I might ask these really sort of vague and nebulous questions. And their measurement is based on this set of facts. But actually what you want to find out is you want to explore people's understanding of their post-procedure journey, for example. I'm trying to think of a specific example. That those facts and that question don't match. So when we're developing our project proposal, we need to think very carefully about what do I want to find out and where am I going to be, what's my epistemology going to be in terms of the information that I'm collecting, and what is my understanding of the information I'm collecting, and is the information I'm collecting factual, discrete pieces of information, age, postcode, and is that information going to answer the question that I've asked?
Yes.
Raina's just nodded at me, that's it.
No, I would just say, I'm going to go back slightly on that and just say, make your work realistic in the time frames that you've got available, and the skill set you've got, absolutely. Don't overcomplicate it. Don't use methods that sound good, but actually use something simple that you understand, that you will do better in the long term in understanding. This is a training. This is a training for the next stage of this journey and for reading research and using research and conducting it in practice. So don't overcomplicate, I think, is my main thing. And I think if you're using an interpretive one, I think even a lot, apart from age and date of birth and things like that, I think even pain scores comes under interpretive. I don't think you can manage it in a positivist way. But you, as in an interpretive model, no matter how much you're aware of your positionality within it, you will always have some influence over what you ask and how you interpret it. But that's okay. That's actually all right. But that is, just be aware of it in that reflexive process. We might talk about it later or tomorrow, I don't know. But that comes into it throughout as well. And you must, as practitioners, you should be doing it anyway. And it's okay to use it as part of this.
So it might be something in your project that you're looking at. You might have some audit information, for example, that has said that, and I'm picking a particular project that I know somebody's got an idea around X-raying everybody that's had a chest drain removed. And the practice at the moment is that everybody is X-rayed, but actually that X-ray is not necessarily required in every case. So why do we? So they've got this audit information, and what they want to do is to find out how they can change practice, how they can develop practice so that they can develop a checklist or some sort of piece of practice development that can identify the people that actually need to be X-rayed. And so there might be sort of, if they fulfill these criteria and that criteria, and what historically, having with all of this audit data that they've got, how many people actually needed to be X-rayed. So positionality in that and reflecting on what people know and how people behave and what is custom and practice will be really important in that project. So even though it might look very positivist in terms of evaluating a piece of practice, it might not actually turn out to be a purely positivist piece of work. So that's epistemology. So again, then the next theoretical level we get to is our methodology. So again, we've got our interpretive side where we might be looking at hermeneutics and dialect, what people say, how people respond to things, how people how people behave in certain settings, focusing on uncovering a variety of constructions that exist, because there's not one right or wrong answer. Whereas in our positivist methodology, we might be taking a much more experimental and controlled stance. So there's an investigative stance and a very controlled and measured stance. So in a positivist methodology, we might be testing a hypothesis. So we might be looking at proving, I struggle with that word, what is right or wrong.
Even that's subjective, what's right and wrong, so let's not go there.
What's correct, appropriate practice and not correct and appropriate practice, but then there's two interpretive researchers sitting here. So
and those things are socially constructed, so let's not go there.
But if we had a positivist, and we possibly ought to get a positivist in on this conversation, shouldn't we? Because they would be, oh, for goodness sake, everything is measurable and factual and blah, 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 and poo-pooing what we're saying. So there's a very different opposing viewpoint. But going back to your projects, what methodology are you going to come from? And it is absolutely vital, and I can't emphasize this enough, is when you're developing your project and your project proposal in this module, that you start and you match it all the way through, because what you can't do is a sort of splatter pattern. So one of my consultants in intensive care uses the phrase a word salad, and I love that because I think it's absolutely applicable in this context. That I'm just going to pick the little bits like a buffet of these ideas and put them all together in a sort of smush. This isn't a smush. We are making a specific cake. So we're bake-off here. We're not making some sort of messy hash. We're making a very specific thing. So if you want a chocolate cake at the end, you've got to put in the ingredients that make it a chocolate cake. So if you set out to do a certain thing in your project aim, then your ontology, your epistemology, your methodology, and your method have to match. Because if they don't match, then you're not fulfilling the criteria of a piece of robust investigation.
Yes. No, I think it's very true. I think it's absolutely, you need to be very clear. This goes back to what I was saying before about don't overcomplicate it, and this word salad is very applicable as well. Don't pick things because they sound good, or the words sound good, or the phrases sound good, or the methods sound good. Use what's appropriate and understand it.
Use what's appropriate, understand it, and make sure it matches your aim. So constantly throughout this process, go back to that question, and I constantly say it to all students, whether they're going on to the research dissertation or whether they're going on to the substantive professional projects, it's the same. What are you trying to find out? What are you trying to do? Because if you're absolutely clear in your head what you're trying to find out, and that is echoed all the way through your proposal, then it will be a really clear, robust proposal. If you sort of not quite sure, I think I sort of want to, and people come up with these sentences, don't they? Well, I sort of want to find out whether X is a good thing to do, or in practice we've been doing it this way, and I really think it would be better to do it this way, and I want to get some evidence together to see that it would be the right thing to do. That's too vague and it's too big. Be specific, be focused, and be absolutely clear.
Yes, and be back to realistic. Don't too big. Everybody has these ideas, and we all do it. And even the PhD, you go, I want to do this, this, and this.
I want to cure cancer.
And you can't do it. Keep it
small and perfectly formed.
Absolutely, and relevant to the time you've got.
We want diamonds, not large bits of granite.
Absolutely. Perfect one. A good quality diamond I'm happy with.
Yes, absolutely. So size is not important. And then, don't laugh. And then the method. So the method in which we're going to undertake, and this is where some people get a little bit sort of lost, because they say, well, I'm collecting audit information and I'm going to evaluate it, so I'm positivist. No, that's not it's not as simple as that. We can use all sorts of different methods to collect the information to answer the question that we've asked. So there's lots of information out there, there's lots of methods of data collection out there, and we can combine a number, or we can do one really well, but it is not enough to say, because I am evaluating audit information, I'm positivist, or I'm doing an interview, so I'm interpretive. We've got to be absolutely clear with our focus. Now, there are obviously some methods of data collection that lend themselves to a certain family, so lend themselves to, for example, the interpretive paradigm or the positivist paradigm, but it's not as simple as that. You need to be absolutely clear. And if you are going to develop some sort of data collection tool, again, does it reflect my methodology? Does it reflect my epistemology? Does it reflect my ontology? And does it answer the question that I set out to ask? So I'm pause at the moment for any questions. Want to take a breath? I'm just going to mute my microphone for a moment. So carrying on, we're just going to have a very quick, by no stretch of the imagination is this everything you need to know about qualitative research, but it's just a little bit of a snapshot, because as I said before, this is a bit of a revision session for research. So qualitative research, qualitative investigations seek to answer questions such as to explore, to examine, to explain, to investigate. They're not testing anything. And so when we set up a piece of interpretive work, we might follow some of these research designs. We might look at it from an ethnographic perspective. We might look at it from a phenomenological perspective. We might look at it from a grounded theory perspective. You reacted then?
I did. I remember going to my end of first year PhD meeting, and I talked about doing grounded theory, and they all just shook their heads. And I ended up doing a narrative analysis. It worked really nicely, but they just said don't go down pure grounded theory because it's such a contested issue. So.
I'm not sure that we've got any grounded theorists on staff anymore.
No, I've not come across anybody.
No. So there is grounded theory, so that's an option, but certainly for your substantive professional project, it's not an area that you're going to be going down, because it simply doesn't work for practice development. But then we've also got action research, and I think for a lot of you, action research is going to be a far more appropriate research design to undertake this sort of project. But there might be elements of ethnography and there might be elements of phenomenology within your studies. And again, phenomenology is a massive area. It's a research design that can include narrative. Some people separate narrative out, but I'm just looking at some global concepts here so that you can start thinking about your research design. If we're looking at it from an ethnographic perspective, we're often talking about human behaviour in the cultural or social context in which it takes place. I'm not sure that healthcare research doesn't always have elements of ethnography in it, because I'm sure if we thought about any episode of practice within our own clinical environments, we'd think, I don't understand why they do it that way, or we do it that way because, and there's an element of cultural and social behaviour that human beings just tend to follow. So when you're looking at practice development, is it about the ethnographic principles? Why are we, if we understand the behaviour and we understand why people are behaving in the way that they are, we might be able to identify how we could change behaviour or develop behaviour or improve behaviour. So ethnography is often an element of any investigation, I think, of human beings. Typically, if we're going down the purist ethnographic route, we're going to have some element of observation. But in action research, we often have an element of participatory observation. So there are elements of ethnography in action research.
I would agree, and I was going to say, even if you are just going down a route of maybe just interviewing, there's still going to be observation of behaviours when you're asking questions. So you've got both actually in there as well. So
yes, that context, isn't it? It's about understanding why people are responding in the way that they are, and
their non-verbals.
So if you do any kind of interviewing as part of this project, it's really important to contextualise that interview, and the purely audio or the purely written transcript is never enough to really understand how somebody felt or behaved or what they understood from something. Focus groups, for example, are a great example of watching sort of ethnographic research in real time. If we get a group of people together to discuss something, and this might be something that you think about doing for your practice development, is, for example, getting all your E grades together, or not E grades anymore, band 6s together, or your band 7s together, and see if there is a cultural and social link between the behaviours of that group of professionals. And if you had a focus group with them, you might see that behaviour is specific to that group, and you might compare it to the group of band 5s, or you might look at it across professional boundaries, and you might look at the way doctors interpret a piece of information versus the way advanced nurse practitioners interpret a piece of information. So there might be an element of ethnography in your practice development, but it might be worth having a little think about how ethnographic research is used and how it's utilised in healthcare. Phenomenology is another research design that we see quite a lot. In a way, it's a slightly overused word in qualitative research, because people think, oh, well, I'm interviewing, so I'm doing phenomenology. Well, there's a little bit more to phenomenology than that. It's particularly interested in how people respond and give meaning to their own experiences, how they perceive the world. But you can use phenomenology in all sorts of different ways. It's an enormous scope for research design, but be very careful if you are using the phrase, I'm going to use a phenomenological study, which again, students are quite tempted to do that and sort of throw it in. You can use a phenomenological approach. Really think carefully about that word, and are you looking at their narratives, and are you looking at their narratives to seek context or look at power relationships? There's all sorts of different things that you could look at their narratives for, but that doesn't necessarily make it phenomenological research.
No, I would
As
agree with that. Because I certainly did a narrative analysis as part of mine, but it wasn't contextualised in this at all. But I do think it is useful for those power relations, because that's what I used it for. But be careful, think about it. And this is about throwing big words into your work. Don't do it unless you know exactly what you're doing, and break it down. So don't just put phenomenological in. I've stuck with that word terribly. Think a little bit deeper, and be a bit more specific in what we want to do.
One of my undergraduate, for their research proposal module, so their last part of their undergraduate programme, said, I'm going to do a hermeneutic phenomenological study. And I went, goodness me, are you? And I said, why? And she said, because I really like that phrase. So again, it goes back to that conversation about word salads, doesn't it? It's, yeah, you may well be doing a piece of hermeneutic phenomenology, but for goodness sake, don't use the word unless you're absolutely sure you are, and you're absolutely sure you understand it, and you're really clear on how you are being phenomenological or ethnographic or whatever it is that you decide that works best with you. And I would really advise you, whoever, certainly myself and Rona, for tutorials for this module, and when it comes to the relationship you build with your supervisor for your substantive professional project, make sure you can articulate very clearly why you are using this particular design, and what you understand from it, so that it's clear and focused. A little bit of grounded theory. Shares with ethnography and phenomenology the study of a phenomena from the viewpoint of the respondent, but the difference with grounded theory is it relies on the data to form the theory, and it uses methodologies and so on that are constantly comparative and can be enormously complex. So although it is some would argue, contested research methodological approach, I would have thought it.
So would I.
Action research is, I think, possibly where you, for this moving forward into your substantive professional project, are going to be, because this is about solving immediate problems, and there's an element of reflective process. So it's about progressing a problem. So you're looking at, okay, what is the status quo at the moment in terms of your particular community of practice, and how you're going to address that particular problem or issue, and maybe an element of solving that problem. So very much about that cycle of, I need to know what's going on, I need to identify how I'm going to improve it, and this is where your data collection might come in, because you might want to do a piece of a focus group with the professionals involved in this particular issue to see what they identify as the issue, because in action research you're not going to get facilitated change unless you've got the engagement of the people involved. So if you work that through in your particular clinical environment, if you want to change practice and you just blanketly say we're going to do it differently now, and you don't have the engagement of the staff that you work with, or they don't understand what the problem or issue is, you're unlikely to be able to get an effective change. So action research is about analysing what the status quo is, and that's when you might be using audit material to find out what's going on. Identify what can be improved or changed, so a progressive problem solving, and then looking at facilitating that change, evaluating that change, and then maybe building. So often research doesn't have one single cycle, it has multiple cycles and multiple layers. Now, as part of your substantive project, it may be that you can only get one or maybe two cycles in your project, because this goes back to the idea of being realistic. Often action research is about, there isn't necessarily a finite end point. There is at the end of it you say, and these are the developments that need to now continue. So it's about identifying a problem, looking in a reflective way about how you can solve that problem or develop that problem, and then address the issues. So I just put a little method here, my input, transformation and output. So the input, that planning, preliminary diagnosis and data gathering. So all of you might be looking at, well, not all of you, but some of you might have some information that outlines exactly what the issue is. So we talk about unfreezing, changing and refreezing. So you've got your planning, then you've got your action phase. So that might be where you put in an education program or a teaching program, or you might put in a particular change in practice. And then refreezing, so looking at the results, has that change in behaviour influenced the data gathered at the beginning, changed the measurements, and so there are lots of loops of feedback. So in this diagram, we've got sort of feedback loop A, feedback loop B, and then feedback loop C. So action research is very much about this sort of cyclical building process. And I think, personally, I think that action research is certainly a methodology or an approach that would be most valuable in this particular setup.
I think so too. But looking at that, and looking at your timeframes, if you get through one cycle of that, I think you'll be doing very well. And I think you should be aware that that is okay.
Yes,
I think that's what I would say, is don't worry about solving the problem completely, but starting some action towards solving it, and one cycle, I think, would be a reasonable expectation.
If you think about your time frame for your substantive professional project, you're going to start it in November. Now, okay, the official start of the module is in November, and so some of the planning and the audit and so on might have already occurred, might be occurring now in practice. You might be able to really hit the ground running in November, but think about in the NHS how slowly things happen.
Think about Christmas and workload pressures.
Yeah, and Christmas and workload pressures and everything that's going to be going on in your personal, professional lives, and think about, and then you've got to submit this in May. So at the end of May, beginning of June, I think submission date, I'll have to check that. So you're thinking about finishing everything within 3-4 months maximum. So that,
one cycle.
Yeah. So do not be impractical. Do not think I'm going to, have done 3 cycles and I'm going to have evaluated the cycles. No, don't. You will be sending yourself to the mental health services if you set yourself up for that. So for those of you who can attend, if not, you're Skyping in on Monday, we'll be looking really, really specifically. And a lot of students look at us at the workshop day when we go, no, you need to be smaller. No, you need to be smaller. And they're going, but is this big enough for a master's project? Yes, because as Rona identified earlier, and I'm sure I've said before, this is about you identifying your ability to do it, not changing the world. This is a training. Your master's is a training process. Some of you will go on and do further research, and brilliant. Some of you may take this into the next phase and the next phase in action research, and that might be your PhDs. Or you might simply have a team of people that actually come on board with this, and it becomes something that's a practice development within your trust that's not got any academic weight to it. But that doesn't mean you might look at it for building conference papers and making really important practice changes, but don't think that this project bit has to be the be all and end all, because it absolutely does not. So that's in terms of action research, the method. So just having a quick look at the time. So I'm going to fly through quantitative research because I'm not sure, certainly in your time frame for the substantive professional project, whether any of you are going to undertake any what I call purist quantitative research. But when you're evaluating the research that you're reading, and you might use some quantitative research as the status quo, you might use some of the research and some of the numbers that appear in papers as the context. So it's very important that you understand the quantitative research that you're reading, because that tends to ask questions about how much, how many, how often, the risks, the proportions, the percentages. So it does lend itself to that idea of numbers, but don't be completely fooled is the wrong word by numbers appearing, because some interpretive research uses some statistical information to inform it and give context. We mentioned age and demographics, and certainly in a lot of the educational research that I'm doing at the moment, I'm looking at GCSE results and A-level results and input tariffs and all of those sort of things to inform some of the information that I'm looking at. So just because it's got numbers and statistics in it doesn't make it positivist, but if the overarching research aim is to establish how much, how many, how often, then it will tend to come from a quantitative paradigm. And so the research designs tend to be experimental, quasi-experimental, and sort of evaluative and looking at interventions. So if we're looking at an experimental design, experimental research is a test. It's a process where ideas and concepts are actually tested against that positivist philosophy. And empirical data is used to explain, and it says increase knowledge. I would possibly argue against that, because it doesn't necessarily increase knowledge.
No, it might support existing knowledge. It doesn't actually increase knowledge, does it?
It was interesting because one of our colleagues said, what was the phrase he used about nothing new needs to be?
Oh, there's nothing new left to discover. We know everything.
Yes.
I don't think so.
Which is but that's a very positivist viewpoint, isn't it?
He is very black and white.
Yeah.
Absolutely.
So the idea that we know everything, everything is known.
What else is there to know? Well, that's the whole point, isn't it? We don't know what else there is to know.
Because we don't know what we don't know until we don't know we know it. So it might be about specifically measuring information about the physical world, so a specific phenomena. So we might be measuring information about childbirth or illness or a specific intervention. The key factors with some positivist research is about manipulation. So we're often in experiments introducing something. So we're changing something. So we might be adding a new drug, adding a new care method, doing a teaching package, and the control is of the intervention, not of the individual. So we're not looking at controlling the people involved, we're looking at control over the thing that we're doing. So often we have a group having it and a group not having it. So we have control groups. So I'm going to try and find out whether this particular drug works. So I'm going to give it to this group of people who all have the same condition, and I'm not going to give it to this group of people who all have the same condition. And this is when we have problems of ethics. So we can't withhold treatment if we know it's going to be beneficial. So often we've got a sort of comparative group. So I'm going to give this drug to this group of people and this drug to this group of people, drug A, drug B, and compare the results. And the elements of it, when we're talking about experimental design, we talk about randomization. So we allocate the groups completely by chance so that we can try and control all the variables around our particular study. And this is where, in a purist experiment, we would have complete control over all of the variables. And which is why in healthcare research we don't tend to talk about pure experiments. We talk about quasi-experiments, and quasi is Latin for false, because we are not able to control everything. And so they're really, we sort of have to manipulate them. But I'm sure all of you in the group are familiar with the term a randomized controlled trial, RCTs, which this phrase in positivist research presentations, the gold standard of research methodology, which I sort of sneer at. I sort of sneer at slightly because I don't necessarily agree that they are the gold standard. They are just one of many research approaches, but I'm sure all of you are familiar with the hierarchy of evidence, with randomised controlled trials being the pinnacle, and systematic reviews all being at the top, and at the bottom, suggesting a lack of quality, interpretive and qualitative research. And there is a very inaccurate, in my opinion, perception of quality associated with that hierarchy of evidence. But it's there, so I'm sure all of you have seen it. And all of you will be familiar with randomised controlled trials. The idea of randomly allocated participants to an experimental or a control group, that the control group receives the treatment, whatever it is, the intervention, or a placebo, random numbers, tables for allocation, so you might have 1,000 patients and they will be randomly allocated to either the control group or the intervention group, and then the outcomes of the different groups are compared. We could discuss for ages and ages the positives and negatives of randomised controlled trials, but we won't go into all of the different things. But when you're looking at a randomised controlled trial paper, think about what they did and how they did it and what conclusions they're drawing. And I think sometimes in randomised controlled trial papers, they make big statements about the results, and then if you really drill down the actual results, then they're a little bit flawed. It's that the statistics that appear on advertising hoardings, isn't it? It's the new anti-wrinkle cream that says 99% of women who tried it agreed that it reduced wrinkles, and then you look in the really small print at the moment that the sample was 4 people, and 3 out of the 4 people agreed. Well, actually, that's not 99% of the population, is it? So just think and be careful when you're reading these papers talking about randomised controlled trials, and understand exactly what they mean by what they're saying and what claims they're making. So for sampling and selection, we don't, in quantitative research, in positivist research, and in qualitative research, interpretive research, we have different sampling and selection strategies. We don't sample everybody, we can't. So think about how we have sampled the group, or how you're going to sample the group. So if you're going to look at a behaviour of your group of clinical staff, how are you going to sample them all? Because you're not going to ask every single one of them. So if you've got 50 staff and you want to find out whether they do a particular thing in a particular way, because you're trying to find out the status quo, you're not going to ask every single one of them. So how are you going to sample? Are you going to randomly select people as they come through the door? Are you going to purposively pick people because of the of what they know? So you're going to use purposive sampling, theoretical sampling, convenient sampling. All sorts of different sampling techniques can be undertaken. But what we have to think about, I apologise, that's one of the phones ringing. No, just leave it, or just zero it. Yeah. Just making sure mine's on 0 now. So when we're talking about sampling, we have to think about inclusion and exclusion criteria, and whether the sample that we're discussing, selecting, is going to be representative and have adequate representativeness to the sample that to what we're trying to conclude. So if we want to find out the opinions of band 5 staff nurses to something, and we speak to 5 band 5s, is that a representative sample? Is that adequate? Well, it may be, dependent on the question that you're trying to ask and the context in which you're asking it. So again, goes back to the size is not everything, but is that adequate? So you have to ask yourselves a number of questions about your sampling technique. So as I've said, with qualitative research and quantitative research, we have different sampling methodologies. So we have non-probability sampling with qualitative research. Its emphasis is on discovering more about a specific thing. So we don't have to quantify exactly how many we might ask. We might use, as I said, convenient sampling simply because they're easy to recruit. So it might be that you canvass the opinion of the first people through the door. That might actually be the best way to do it. But support why it is the best way to do it and discuss why you've chosen to recruit in that particular way. You might use purposive sampling, so deliberately non-random selection of people because of what they know and who they are and a specific characteristic that you might be looking for, or theoretical sampling when you're looking for a group of people because they know something specific about whatever it is that you are trying to find out. Obviously, the disadvantages here are they're not generalizable, and you might have a degree of researcher or investigator bias, but as long as you have supported that with discussion and sort of, in a way, confessed to it, it is an appropriate way to sample your desired audience or desired participants. So a lot of the time we are pulling on methods from both camps because that gives us a far more appropriate view of the world, but certainly in terms of action research, you might certainly be pulling on quantitative data, qualitative data, to get a holistic picture. It's very much what we call post-positivist thinking, and you might be looking at it from a specific perspective. But again, it goes back to what I was saying right at the beginning about ontology and epistemology, is you've still got to be absolutely clear what camp you're coming from. So you might use quantitative data, you might use randomized controlled trials to establish the status quo in your audit at the beginning of your action research, but where you take it after that and the questions that you're asking about practice and practice development are very interpretive. And so your whole project should mimic and should demonstrate that interpretive paradigm. So I think I've sort of said that. We use qualitative data in quantitative research. Equally, we use quantitative data in qualitative research to ensure that we've got a triangulation of material. We use multiple methods to increase our validity and reliability, which I think goes back to that ontology statement, because I believe personally very strongly that multiple realities exist, that you can't get one answer. You'll get a series of answers, and then you need to interpret those answers in terms of the question that you're asking.
Especially when we're looking at anything that involves human behaviours.
It would be lovely to say that all nurses behave in this way, or all doctors behave in that way, or all patients with respiratory conditions behave in this way, or all patients undertaking this particular surgery follow this particular path. But that's not how human beings are, and it's not how they respond. So when you're developing your proposal in terms of your project moving forward, you need to very much take that into account and think, what is real life like, and how am I going to adequately investigate it? So, any questions? If you don't have any specific questions now, perfectly happy to address any questions via email over the next couple of days, because I'm sure some of you, and certainly those of you who are listening to this as a recording, might have a list of questions to send me. Please don't hesitate. So happy to answer any questions moving forward. I'm going to stop the recording now. So this is for those listening to this as a recorded session. I'll finish now, and as I said, please don't hesitate to ask any questions via email if you require.